Hi, Dr. Sasse here from the Continence Center at Sasse Surgical, and I was asked recently, what does it mean to have a multidisciplinary approach to the management of my bowel and bladder problem? This is referring specifically to bladder leakage or bowel leakage, which often go together. So many times one person may be experiencing a lot of bladder leakage, which is getting worse over time. Someone I just saw very recently was saying that she had kind of had to graduate up into higher and higher level or grade of pads, so that she's now using a level 6 pad and it's getting soaked 3 times a day. And when I asked about bowel incontinence, she's experiencing that too, but is a bit embarrassed to even discuss that. But those go together. That is the same neural and muscular network that controls the pelvic floor. And that's what gets fouled up over time and leads to having leakage from the bladder and from the bowels. And there are excellent solutions. So when I say that at the Continence Center we offer a multidisciplinary solution, what do I mean by that? Well, first I mean that we do an evaluation which attempts to understand all aspects of it. So that ranges from testing the urine to look for infection, to look for undiagnosed diabetes, to look for blood in the urine, could be a hidden cancer. It means testing the stool and the bowels and the neuromuscular physiology of the pelvic floor to understand if the problem is neuromuscular or if the problem is related to diet or bowel dysfunction. Each of these can play a role in ultimately having incontinence from the bowel and bladder. And then it also means that the solutions must often be multidisciplinary. So we are surgeons, we like to fix stuff, but it turns out in the history of this whole field, us sewing things together using muscle repairs and mesh slings and things like this have not proven very successful. They've proven quite disappointing, in fact, and even though they're fairly invasive as surgery goes, they've not produced the kind of long-term benefits that we had hoped for. Nor, unfortunately, have medication solutions, despite the immense amount of advertising and promotion by the pharmaceutical industry. Medications for bladder leakage are not very successful, they're very expensive, and they have a lot of side effects. So definitely not quite what we're aiming for. Nonetheless, there are times where each of those categories must be brought to bear in a careful way to help the problem. So we will sometimes recommend use of medications as an adjunct to the treatments that we recommend. We'll sometimes recommend the use of fiber or antidiarrheals such as Imodium to augment the treatments that we recommend. And sometimes there may be a role for surgery, particularly if there is a loss of the integrity of the pelvic floor and there's pelvic organ prolapse, rectal prolapse, bladder prolapse, uterine prolapse. These sometimes do need surgery in order to make the problem better. Additionally, the multidisciplinary approach involves the use of new technology that involves using injectable bulking agents. This is for both the periurethral tissues for the bladder and in the perirectal tissues or sphincter areas for the bowel. And these two are overlapping technologies that use specially designed polymers that are injected carefully into precise locations that can bulk the tissues and provide improved control for the bowel and bladder. And lastly, of course, if you've followed our other posts or watched other videos or read our materials, you know that we believe that the cornerstone therapy for restoring bowel and bladder control is usually the restoration of the nerves and muscles using what's called sacral neuromodulation. And that big mouthful is actually a very simple 20-minute-ish procedure. Involves placement of a small device under the skin that works a lot like a cardiac pacemaker works, where it uses some sophisticated computer technology, sending a little gentle current in a programmed fashion to restore, in this case not the heartbeat, but in this case the pelvic floor function, so that the sphincters now work properly like they're supposed to, and that resolves bowel and bladder leakage around 90% of the time. So in the right hands with the right depth of training and neuromodulation, and that for me goes back 20 years to the foundational research of sacral neuromodulation and pelvic floor physiology. That treatment can serve as a cornerstone, but because of the multidisciplinary aspects, we're also able to bring to bear the treatments that may augment that and turn it into a 100% solution for many people. So with that said, I know that was kind of a mouthful, but That's what we mean when we talk about a multidisciplinary approach and a multidisciplinary solution for bowel and bladder incontinence. So I hope that's been helpful if you or your loved one is trying to grapple with what the heck do I do for this problem. Try to seek out a provider who has a depth of knowledge in a multidisciplinary fashion of incontinence, of bowel and bladder leakage, and can really sort of understand the whole interrelationship of the problem and bring to bear those solutions, even though they cross disciplines and they require a kind of a depth of training and understanding. That's really going to deliver the best results for you. All right, I hope that's been helpful. This is Dr. Sasse at the Continence Center, and I wish you the best of health.